Good morning, and thank you for joining us for SBB Live. I am your host and the publisher of Seniors Blue Book, Amanda Barton. And in honor of May being Mental Health Awareness Month, I'm really excited to bring on Jessica Bennett from Park Royal Hospital. How are you doing this morning?
I'm doing great. Thank you so much for having me, Amanda.
Absolutely. I'm really excited to hear about a little bit about you. What brought you into the field? Tell me a little bit of your history.
So I've been interested in behavioral health and passionate about behavioral health for a long time. My sister was adopted and really struggled with some mental health issues and substance abuse, and actually died of an overdose when she was 28.
I'm sorry to hear that. So that really explains why you have such an amazing passion for what you do. Now, Park Royal has some unique features. Tell me a little bit about Park Royal Hospital and some of the unique features it has.
Sure. So Park Royal Hospital is a 114 bed and freestanding inpatient hospital. And we also have ECT services and outpatient services. Our 114 beds are separated into 5 specialty units. So we have an acute unit, which is a small unit for your aggressive type patients. We have a subacute unit, which is still acute patients, but not aggressive. We have a co-occurring unit for those struggling with substance abuse and mental health issues. We have an all-female unit, which specializes in women's issues. And then we have our geriatric unit, which specializes for older adults struggling with cognitive decline, confusion, and sometimes dementia.
Yeah, these are very unique services that you offer. So I'm really glad that we're talking about all of these today. Tell me a little bit about how Park Royal partners with the community.
Sure. So we have a team of liaisons like myself who partner with the community to provide resources for all levels of care. It is about finding the best fit for the patient. So if we can't meet the need of that patient, we will find the source that can. And then also when discharging patients for aftercare, we make sure we provide the best fit. So if a patient needs SNF or assisted living or residential treatment for substance abuse, we help find that care. And I do want to say also something that separates us is our patient-centered care. We provide excellent care. Our philosophy is if you provide excellent care, everything else will follow. And I was real impressed with this hospital. Like I said in the beginning, I've been in this field for a long time, for about 17 years. And when I started Park Royal, I was very impressed with the leadership and just how they go the extra mile to provide that care.
That's fantastic. Tell me, I know that some people will have questions about how the pay structure is and how you're able to get help. What insurances do you accept there at the hospital?
We accept Medicare, we accept managed Medicare, managed Medicaid. We don't accept the state Medicaid, but all of the managed Medicaids and all the major private insurances. And if there's an insurance that we're not in network with, we can get a single case agreement. So we do, there's not very many people who get turned down for lack of being able to pay.
That's amazing. That's really important to cover. I think a lot of people are scared to make that call. And we're, obviously with this call today, trying to build awareness and make sure that people know that they are going to be taken care of. Tell me, how would someone make a referral if they feel like somebody in need?
To make a referral, I would say call me. I can shepherd them through the process. So there are certain documents that the admissions team would need, and I can tell them what those documents are. I can help them through the process and streamline the process, and then help them understand what is expected of them, what the patient's stay will be like. I can connect with the families. And sometimes I'm a listening ear. It could be a very stressful time, not just for the patient, but for the families. And I can help them through that process.
Now, that's great. Um, we're all obviously going through a very unique time right now. And I've, this last couple of weeks, especially, we've been asking the same questions about COVID-19 and how different facilities are dealing with that. Park Royal obviously has a plan in place. Tell me about that. How are you guys dealing with this pandemic?
Well, we are making ourselves available through Zoom through Zoom for our community partners. So we want to be a resource for them and to guide them and help them. And we are also providing a virtual IOP and PHP services, which is intensive outpatient services. So basically, how our outpatient was structured before was that the patient would come there every day and attend group therapy. But now our clinicians and our providers are providing the group therapy and medication management virtually. So without leaving the comfort of their own home, they can still get the same excellent care that they were receiving before. So, and what this also does is where we had, before you might not want to drive 30 miles or 40 miles for this service, you now can get this service anywhere in the country, really, but anywhere. So it's been very helpful. Our hospital has been open throughout all of this to provide the community need for mental health. As you can imagine, the calls have definitely increased. And we're following all of CDC guidelines and screening all of our staff and all of our patients. And we have remained COVID-free to date.
That's fantastic. This is really probably going to change a lot of how we're able to do these calls in the future. It's kind of opened our eyes, and mental health is such an important thing that we all need to talk about. Breaking the stigma is really important. Tell me a little bit about some of the educational opportunities that may be out there for our seniors and healthcare professionals, and even beyond that.
Sure. So we have been very avid in providing resources for the community. Every month we're providing CE education as well as non-CE education. And this month we have a new series coming up starting May 29th on domestic violence. I don't know if you know, that has increased during this time. So we're going to be providing some education on that. It's a 3-week series, so it'll be every Friday at lunch on domestic violence, human trafficking. And then following that, on June 19th, we have Cynthia, the elder care strategist, who will be providing education on isolation and its effects.
Yeah, and it's so scary that this is what we're going through, because it's a common fact that isolation is very, very stressful. And right now, I think we're all feeling it, even those of us that may be feeling like we're mentally stable. So, well, I just really appreciate you coming on the show today and talking to us about this really important topic that I don't think we discuss it nearly enough. So I appreciate your time, and I hope you have a fantastic morning.
Sure. Thank you so much for this opportunity. Like I said, we want to be a resource to patients. We want to be a resource to all of the community for all of your mental health needs. So thank you. And we look forward to one day when you are all able to come tour our facility.
Absolutely. I can't wait to be the one to walk them through and get that out there for you.
Thank you so much.
Thanks for your time. Bye-bye.